Welcome, welcome, Sarah. It's so good to have you on here. How are you doing today?
I am great. Thank you so much for having me. I appreciate it.
Yes. So why don't you tell people a little bit about your background and what got you to where you are today?
Sure. I am a licensed clinical social worker. I have my own private practice in Augusta, Georgia. I've been practicing in mental health, let's call it 20 years, maybe a little more than that. But a little over 20 years at this point with specialty in trauma, depression, anxiety, those types of things. Recently though, I have launched more effort towards my public speaking. And
Mm.
so in public speaking, what I've really found is that I'm giving all these skills to my clients, and then they're going into the workplaces and not having the opportunity to utilize them because our workplaces are so focused on individualization and productivity that they actually don't pause to notice how the workplace is actually structured to counter productivity and retention. So that's kind of really my message that I'm trying to get across right now.
I love that. And I thought this was such a great conversation to have because it's not something that I've really discussed on this podcast in depth of every day people are going to jobs like you are spending 40 plus hours a week at a job, or even if you work part-time, right? It's like good chunks of time. And depending on where you're going and who you're around, that time can be really challenging.
It really can. Yeah.
And there's so much good advice out there. Like I know it's like I might suggest certain things and it's like, well, that's just not possible at my job, you know?
Mhm.
And
Mhm.
so can you talk a little bit about what people run into? Like when you say things are structured against productivity, I love the way you put that, by the way, because it's mind-blowing to me of like, do these people not, are they not able to like think forward like a year to see that things are going to cost them so much more money when they're not taking care of their employees? It feels so common sense. But
Yeah.
what kinds of things are working against individuals that are just trying to show up and do their job?
Well, I think that one of the biggest things that I notice is the US culture specifically is very production driven and very individualized. And so it is about go. And without using the team and the community around us. And so being able to pause and say, hey, I may not be able to get this task done. Could you help me out with this? And we're afraid to say that because management in a lot of settings has really set it up for us to say, you need to perform and you need to do your job and not ask somebody else to do your job. And I'm really trying to get across to managers and administrators that we're not asking for employees to be told they don't have to do their job. What we're saying is, let's say that I'm a nurse and I'm working the floor and I'm supposed to go and run and check on my patient. Great. I'm going to go check on my patient and then I'm going to come back to my nurse's station and I'm going to write my notes. Fabulous. Well, then the buzzer goes off in that room again. If I'm in the middle of a note and another nurse walks by, I can say, hey, do you mind? Check in with them. If I need to do something, I'll be right there,
Mhm.
right? Versus I'm in the middle of my note and I'm typing that up and I'm hearing the buzz and I'm going, oh my gosh, I have to finish this note really fast and I have to make sure that it sets all the parameters that the documentation has to set. Oh, and then I have to go rush and check on that patient and stop what I'm doing instead of just asking the community around us, hey, do you mind just lending me a hand? Even if
Mhm.
that just gives me a 2-minute gap before I do the work. And I think that, if you think about the amount of money, you even mentioned it a minute ago, the amount of money that businesses are losing because we are not taking care of the mental health of our
Mhm.
employees. There was actually research that shows that globally, there are 12 billion working days that are lost every year due to depression and anxiety, which is costing us globally $1 trillion annually in productivity.
Wow.
I don't know too many businesses that are looking to really lose that kind of money on a
Right?
regular basis, right?
Wow. Yeah, I think this brings up such a good point, and I did not know those stats. That's just like mind-boggling, and I'm like not surprised by it though, because I, I feel like there's a push in the, at least in the circles that I hang out with in the mental health world of like, don't talk about productivity. It's not about that, but it's like at the end of the day, productivity is important, especially if you work a job like we do. We have to acknowledge we live in a capitalistic society.
Mm-hmm.
And so there is like being productive. I think humans, when it's done in a way that honors the human, I actually think being productive is really fulfilling. There's a lot
Mm-hmm.
of nuances there, but it's like productivity is not bad. Like, let's not, I'm just
Right.
saying that because I think a
Right.
lot of people listening might be like, no, she's talking about productivity and that's bad. And it's like, it's
Yeah.
really not. Like, we like to be productive. Like, think anyone listening, think about when you get something done, you just like, even if it's just like, oh, I just made this like really nice meal for my family, or like, oh, I finished this project. Like, it feels good.
Mm-hmm.
And so there's nothing wrong with productivity. What's wrong with it is when it's being emphasized and then we're doing all of these things to actually make it so much more challenging to be productive. Like it blows my mind of like the disconnect between corporate and managers who are like productivity, and then they do all these things to undermine it and then like be mad that productivity isn't where it is. And it's like if you literally just like gave your employee a pee break, they'd actually probably be more productive. We're like,
Yeah, yeah.
no,
And
but you
sometimes
can't
it can be
pee.
that, sometimes
Yeah.
it can be that simple. And that's really the message I'm trying to get across is
Mm,
that I am not advocating for big, huge changes, right?
mhm,
We're looking at some really small things. So one of my favorite examples, and I let my old manager know that I was going to be using her as examples, but I had a fabulous manager at a hospital that I used to work in. And so in most hospital settings, the doctors
mhm,
are the top, nurses, therapists, admins, it all ranks down from there. And my manager in the mental health unit was fabulous. She had a rule in our staff meetings that said everybody in the room has an equal voice.
mm,
And that was known. And so one of the things that we talk about in increasing productivity in the workplace and taking care of mental health at the same time is do all of the employees feel like they have equal voice? Do they feel like their value and worth is noticed and appreciated? And so we would go into these staff meetings, and let's say that the problem was we're not responding to emergency calls fast enough. Great. So then she would ask the admin staff, well, talk to me about when you get that call or when somebody asks you to make a 911 call for us. How is that working for you? She would ask the nursing staff, hey, tell me what's going on when those crises happen and you're
mhm,
with another client. How are you handling that? Are you getting what you need? And everybody at every level had the same voice. And
mm,
then we would come together to figure out as a team, how can we solve this problem? Right. And that
yes.
was huge because, coming from a childhood where my mom was what used to be called a secretary, that's a no word anymore, right? But my mom was an administrative
Mhm,
assistant,
mhm,
and I would see her be treated oftentimes as a secretary. And then I saw her move to other employers that looked at her as you are an integral part of how our system functions. And so when we notice people and we give them a voice and we say, what's your thought? How do you want to play a role in the bigger picture? Right? That's such a huge benefit to their mental health. So whether
Yes.
you are the admin assistant or whether you're the physician or the CEO, everybody has an equal voice.
Yes. I love that so much. It's such a beautiful way to put it. And I love how when you were talking about even just that like chain that happens with a 911 call, which is, not something I've ever dealt with, you know what I mean? But it's like, I think everybody in whatever job they're in, they can see where there's this chain. And it's like wherever the bottleneck is, wherever someone's struggling, it's gonna affect everybody.
Yeah. Yeah.
And yet it's so challenging sometimes to bring everybody in. It's what do you think creates that challenge? It's like, why is it so hard to give people an equal voice? Like, what do you see as the main cause of that?
I think I'm not really sure exactly what the main cause is because I think that oftentimes it varies from environment to environment. So,
Mm-hmm.
for example, when I worked in the hospital, that is an archaic structure that has been in place for hundreds of years,
Mm-hmm.
right? That's the level. I think that sometimes it's also based on our belief that depending on how many degrees you have, college
Mm,
degrees you have, or letters after your name, that somehow means something more than it does,
mm-hmm.
right? So, and I'm not dismissing that. I have letters after my name. I have multiple college degrees,
Yeah.
but I'm not dismissing that effort, but understanding that sometimes that is more of a reflection of resources and time than it is of knowledge and understanding of the system. And
Mm-hmm.
so when we can start looking at people and saying, okay, admin assistant sitting at the front desk, what are you noticing is causing the bottleneck? And that admin assistant may say, well, you know what? What's happening is we're telling people to come at 10 and the intake nurse is not getting to them until 10:30, but the physician has them scheduled for 10:45.
Mm-hmm.
So why is the intake nurse not getting them until 10:30? Oh, okay. So then we can go to the intake nurse.
Mm-hmm.
Okay, so intake nurse, what is happening from 10 to 10:30 that is not allowing you to get them? Oh, well, I didn't get the chart, or I'm in that staff meeting until 10 o'clock, and then I have to get my stuff together. And so I can't actually see a patient until 10:30.
Mm-hmm.
Oh, okay. So we actually need to not do intakes at 10 o'clock because we have that staff meeting from 9 to 10 that usually
Mm-hmm.
runs over, and then that's causing the bottleneck,
Yes.
right? So when all the levels are talking to each other and really owning their part,
Mm-hmm.
then we get to move forward. There was actually a really interesting study published by the US Surgeon General's office in 2022. And it identified 5 areas of well-being that need to be present for good mental health in the workplace. And those 5 areas were protection from harm, connection and community, work-life harmony, mattering at work, and opportunity for growth.
Mm-hmm.
And I think if we're going to work on those 5 areas, we have to overcome the biases that we have about mental health, right? So now that I think about that, maybe more of the answer to your earlier question about what is some of the hang up, right?
Mm-hmm.
Those biases, we think that mental health means that somebody's crazy. Ugh, I don't even like the word coming out of my mouth. But we believe that they're crazy. We believe that they're irresponsible. We believe that they're dangerous. If you look at some of the language that we use in our culture, going postal.
Mm-hmm.
I don't know
Mm-hmm.
about you, but I grew up with that phrase, right? Somebody
Yeah.
says, go postal. And when we think about what does that mean? Oh, well, then they're crazy and they're going to go wipe out the entire workplace. No, quite honestly, most people that struggle with mental health conditions, a diagnosable mental health condition, they actually are very terrified that their mental health condition is going to be seen and observed in the workplace because they
Mhm.
don't want the bias.
Yep.
Right? So they're
Yeah.
actually hiding it all. They're really, really
Totally.
hiding it all. I talk to my clients all the time about, one of the introductory questions that I'll ask them, I'll say, so how often do you go home and cry in the shower? And their eyes just get really wide and go, how do you know that that's what I
Mhm.
do? And I'm like, oh, because a lot of people who struggle with mental health conditions have to hide, right?
Mhm.
And so
Oh,
they
absolutely.
they armor up at work
Mhm.
and then go home and cry in the shower.
Yeah.
Yeah,
Yeah.
it's really
And
tough.
and how much too and it's like, and I know this is not a a clear answer at all, because this is going to be this very different from person to person. But what I'm particularly interested for the purpose of this podcast is how many people who are presenting with mental health issues, or going home, and let's just like leave it vague, of like, or going home and crying in the shower, are doing so not because there's anything wrong with them, but because they are not being seen at work. Their voice isn't being valued. They're basically being dismissed and then basically punished or chastised for like not being able to do their job when they were trying to speak up for the exact reason they can't do that, right? It's like that's what gets you feeling crazy. And not
Yeah,
to use that word, I know you don't like that word. I'll use that word a little more like in jest, I guess. But it's like,
yeah,
I think people can be like, oh my God, like I'm feeling crazy here. Like I'm trying to tell my boss what's wrong and they're not listening to me. And then they're getting mad at me for not addressing the very thing that's wrong, but they're not hearing me when I try to tell them what it is, right? It's this like, what is how am I supposed to it's like it's so much bigger than them. It's not something that they can individually, quote unquote fix, if it's something that is broken, because it's beyond them. And then yet it's like it's falling on them to do something that's just so outside of their scope.
yeah, yeah. Well, and I think that that really speaks to the idea that it has to come from both sides.
Hmm.
So one side is that we have to feel as employees that we can advocate for ourselves.
Yes.
So that may look like saying, if you're receiving mental health therapy, and I've really helped a lot of my clients be able to get here, where they can go to their management and they can say, hey, my therapist only works business hours. Can I leave an hour and a half early on Wednesdays so that I can go to my therapy appointment? But I will work an extra hour and a half every Tuesday
Hmm.
so that I can take off on Wednesday. So they're not asking to work less. Most of them need the money to pay for therapy
Yeah.
as it is.
Yeah.
So they're not asking to work less or to decrease their productivity. But what managers would notice then is that they are getting the help and the support through their therapy appointments to be able to navigate interpersonal dynamics, to be able to navigate the stressors of productivity needs
Hmm.
so that they can do that. So you end up with a healthier employee. Healthier employees stay at work, they don't call out sick, they have increased productivity, right?
Yes.
Or, sometimes it's as simple as if you've ever had the experience where you've gotten an email and they're asking a question. So let's say that your boss sends you an email and the email says, hey, I've noticed that, let's say that the project that we're working on has a whole bunch of corrections in it. I was wondering what the plan is to make those corrections. Now, that email is fine if you're receiving that at 10 a.m. and you work office hours. Now I want you to put that email at 7 p.m. So you're scrolling through your phone and your notification pops up that you have an email from your boss. And I would challenge your listeners, how many of them feel like they have to then at 7 p.m. respond to that email at 7 p.m.
Mhm.
So my challenge to your listeners, if they're the employee, one would be to simply let their management know, hey, I really want to be a team player here, but I will not be responding to emails that are not of an emergency nature outside of my working hours. Right. And that answer needs to kind of be varied depending on what your field is,
Mhm.
right? If you are an ER physician and you're on call, I'm
Yeah.
sorry, but you gotta respond.
Yes.
There are lives at stake, right?
Yes.
But if you are a engineer or an architect,
Mhm.
is there any reason why you can't wait and respond to that email at 8 a.m.?
Mhm.
Right? So that would be my challenge if you're on the employee end. My challenge to the managers and the administrators is, why are you sending the email to them at 7 p.m.? If you are choosing to work outside of what is considered to be healthy hours, then set the send time, which you can
Yes.
do on
Thank you.
all emails. You can set the send time to 8 a.m. the next morning. Right. So if you really are afraid that you are not going to remember to ask that question, fine. Draft the email, but pause, because even if as a manager, if you start the email with, I'm sorry, you don't need to respond to this till tomorrow morning. We don't really have to talk about it. I just didn't want to forget. What's going to naturally occur to the employee is they're going to say, oh no, okay, I have to come up with a solution to this. This is something that's really pressing. And now you've hijacked their mental time, their mental decompress time in the evening with finding a solution to that problem. And we don't want to do that. We really want to set those boundaries around work time, that work issues are only being addressed during work hours,
Mhm.
unless you're the ER physician.
Yeah. Yes. I want to like talk to, I want to bring back to one thing that you said earlier, because I think it's so here is you made a comment about knowing your scope or like knowing your role. I forget the exact wording you use. And I think this piece is like, before we dive even into the other stuff, is so important, because this is where I see people get caught up all the time, is they are taking on responsibility for things that are not theirs to take responsibility for.
Yeah.
It's just not like they're within their job role. And it doesn't mean that, I think there's nuance to everything. If it doesn't mean you're just like, well, that thing is getting screwed up, so I'm just going to turn a blind eye. But it's just being very aware of like, hey, I spoke up for this one thing. I've done my part. I've drawn, like, if there is something that's going on in another department or about another member of your team, or, something that's happening, yeah, you can speak up, but it's not your job to fix it.
Yeah.
You might need to know, okay, do I need to say something here? Or can I trust, right? It's like there's going to be critical thinking that has to occur at every level. But when you're really crystal clear on, here is my role and this is my expertise, and you're able to own it, decisions become way more easy. So it's like you were talking about the doctor who has more degrees over their name, so they have this higher value. And it's like, yeah, if they're a surgeon, they should be the one who's giving information about what's happening during a surgery. But if the issue is around the prep time or the cleanup time that's happening afterwards, they shouldn't have a say, because that's not their area of expertise. The janitorial staff, or whomever is there, that's their expertise, and they get to be the ones speaking up about it. So I think it's like as rightfully assigning whose expertise is this to speak up on, and letting that person have the voice. And for every listener, just thinking of like, where is my role? And I think a lot of people want to skip this because it seems very obvious to them. They're like, well, of course, like, well, I'm the therapist. Well, and it's like, I have someone right now, she might be listening, who's an occupational therapist. And this is something we talk about a lot, because it's like, she's at a skilled nursing facility. So there's a lot of moving parts, and there's a lot of things where it's like other people on the team aren't stepping up, or she's not even giving them the space to step up, because she's just taking on, like, trying to take something on that she doesn't have the resources to do. And then getting really stressed about it, understandably, because it's like, oh my gosh, here's this thing that I'm seeing as this issue that is an issue this person needs help with, but she doesn't have the resources to fix it, nor should she. It's nothing wrong with her at all. It's just making sure the person who does have the resources is notified. And that's where her then job ends, right? It's
Mhm.
like, all right, made the note. I've made the notification to bring in this support staff. Done. That's all she has to do.
Yeah.
And so when I want to state that because I think then when you're talking about like the emails and everything like this, when you know your role, like, hey, you're an ER doctor, or hey, there's currently I'm in this project that has all these time demands, and it's like I've actually worked with an architect who has done stuff after
Mhm.
hours, because it's like with certain things there are these deadlines that things have to be done. And so it's like when you're very clear on like, okay, for this piece this is necessary to work after hours, or this piece, it's not an emergency.
Well, and I think that, Andrew, it's really important that when you say that this piece,
Mm-hmm.
that those are temporary, because
Mm-hmm.
oftentimes we will continue to justify
Yes.
outside of when it truly is I have to right now. So the architect, if the building has a deadline to be done by December, right now it's the
Mm-hmm.
springtime. If it has a deadline of December and that architect says, well, but I have to get this response so that the next part of the chain can get it done. Great. But my challenge to that architect would then be, is the next 6 hours
Yeah.
truly going to make a difference? Now, if we are at December 1st and it
Mm-hmm.
has to be done by the end of the year, that 6 hours might make a difference. But in the spring, if I wait 6, 8 hours until I get back to work, does it actually make a difference? And for other
Mm-hmm.
things, when I work with my folks who struggle with anxiety, one of the questions that I learned that comes out of the dialectical behavioral therapy modality is, will this matter in 5 years?
Mm-hmm.
So when we're trying to make that decision about, is this one of those times that Andrea and Sarah were talking about that I really have to respond right now, then I would challenge your listeners to pause and just notice, is this going to matter in 5 years?
Mm-hmm.
And if it is, by all means, move forward, right? So the ER doc, if they get the call, and they say, I don't think I want to respond to that right now. Is that going to matter in 5 years? Yep, it
Yep.
probably will, right?
Yeah.
If it is a matter of, we need to write a new policy, and
Mm-hmm.
I'm finding these problems with the first draft. If I choose to wait 8 hours until I get back to the office, in 5 years, is my waiting 8 hours really going to matter? No,
Yeah.
because writing new policies takes months, if not years, to get the balls rolling. So that 8 hours really needs to be
Mm-hmm.
spent with taking a breath, taking a break, right?
Mm-hmm.
And really
Yes.
encouraging both sides, like I said, the management and the employee side, to really notice that,
Mm-hmm.
right? And being able to do that. There's a great quote that I found one day when I was looking around at material, and it's attributed to Sadhguru, that says there is no such thing as work-life balance. It is all life.
Mm.
The balance has to be within you. And
Mm.
work-life balance is such a
Yeah,
catchphrase right now,
it
right?
is.
It's the thing. There's all the things about it. Find work-life balance, find work-life balance. And I thought, what a great reframe to recognize this is not about work-life balance. This
Mhm.
is about, all of this is life. How are we
Yes.
choosing to spend our life on both sides of the aisle, whether we're looking at the managers or
Mhm.
the employees?
Yes.
How are you choosing to spend life?
Yes.
And is that creating wellness within you?
Yes. I love that. I love that. Yes, because I feel like that phrase is very gets gets used in ways that are not helpful.
Yeah.
And I wanted to also go back to the emails, because I do think emails are such a, like, emails, phone calls, things like this are such a place where people experience this tension.
Mhm.
And and I love that you just brought up, because, and it's like, I want to highlight this because it's such a simple thing that I think a lot of people don't know exists, of you can pick your send time.
Right,
Because I
right.
didn't know this existed until like a year ago or something. And it's, find what happens is, becomes this vicious cycle, right? You have a manager who's sending an email at 7 p.m. Then you have the person that's like, I'm aware that if I don't respond, it's gonna hijack my whole night. So it's just easier if I respond, right? And it does, it makes them feel better in the moment. So they respond. And what does that do? That teaches the manager that they can email them and they will respond. And so I had a client who had a manager that was just not someone who was exactly the most receptive person and would do this. And she was kind of stuck in this cycle. And so this is exactly what I suggested. I was like, respond then, like, for your own sanity, because it really was. She could totally just chill after. And usually there were quick things, right? But they were just annoying, and it was, it would get in the way of her night. So I was like, but schedule your response for the morning. So
Mhm.
you're just, and she was just like, oh, and it stopped. It was just like, she trained him over, it just like took like a couple of weeks.
Right.
And I mean, she had already brought it up before, so I think there was like an awareness of it there, but
Mhm.
like, then he just stopped asking, and then and so it went away. Like, and obviously that's not going to be the case in every person's case, but there's just kind of ways that you will train your managers or train the admin that you will respond after hours when you are responding after hours.
Right.
So if as a temporary bridge into creating better boundaries, you are just setting your own response time for the morning, or like, not, don't do it at 8 a.m., do it at like 10 a.m., right? Do it like well within work hours. You also start to make it clear that you're not going to tolerate it.
Right. Right. Right.
And I think this is the both and right here, is because we don't want, like, let's talk about, I think you've had some really beautiful language about how to approach managers and how to approach bosses of things like that to start creating these boundaries. So how do you recommend somebody start this conversation?
I think if you are in a managerial role at whatever title that is for your organization, the first thing that I would suggest is completing an employee satisfaction survey
Mm,
and actually read it. Number one. Number two, come back to your staff and say, in reviewing the satisfaction surveys, these are the things that I saw. I would like to start a conversation about each of these top 3 points, one at a time. Okay. And sometimes, because most of us, when we are working in more unhealthy, we won't even go all the way to the toxic, just
yeah.
the more
Hmm.
unhealthy environments, we tend to fill out those employee satisfaction surveys with all fives. Everything's great. I love my job. Everything's fabulous, because nobody's going to read it. So if, as a manager, you're receiving those reports, know that it is less likely that that is actually the reality, and that it's more of a response of protection. I don't want this to come back at me saying that I'm a whiner or that I'm a complainer. So if you're getting those responses, right, then you come back to your staff in a small group setting and you say, hey, I noticed that I'm getting all fives, that everybody loves being here. And I kind of doubt that that's true. And I would really like to have some candid conversation. So let me start with what I noticed. And so as a manager, the more that you can put yourself in a vulnerable position, and I say vulnerable with boundaries. I'm not saying go to your subordinates and say, oh my gosh, my job sucks and it's so stressful and I can't handle this, right? We're saying go to your subordinates with an example might be, hey, you know what? The hospital's going through this merger right now. And it is putting a lot of pressure on all the levels. I know for me, what I'm getting pressure about is, right? And that's hard for me. I would really like to hear where you guys are feeling the pressure. So that's what I mean by being vulnerable with boundaries. I don't have to be, as a manager, wide open. I don't have to lose my status or my presentation of power, but I do want to present as being a human being, right? Because if, as a manager, you are presenting to your subordinates at a superhuman level, and you're saying, I've got this, and I'm strong for all of you, and I've got this, and this is the plan, and this is what we're going to do, that automatically creates a wall where they're not going to feel comfortable coming to you and saying, hey, that new policy, I don't think that's working so well. Right? When I worked at the hospital, we had, so JCO is the accrediting body for a lot of hospitals. And if your department even is not fully meeting the JCO requirements, they can shut you down. Like, as the representative is there following through things, they can say, you don't meet criteria, shut down, send all your patients away.
Dang.
So we had this great thing where at intake, we had 4 forms that the staff was filling out. And if you looked at the 4 forms, there was overlap over every form. And it didn't make any sense. And the staff was really overwhelmed, going, why are we spending so much time doing all this paperwork? And so I was assigned to go back and relook at it and review the JCO requirements. And what I found was JCO kept changing the rules. And so another form would be created to meet the rule. Nobody ever bothered to say, hey, what if we just recreate one form to include the old information and the new information? Remember, I worked for that fabulous manager who said, if it's not working for you, come to me with a solution. What are you willing to do? And so I knocked on her door and I said, hey, can I have a slightly decreased caseload for my individual clients while I go through and review all the JCO requirements and figure out which of these components of these 4 forms do we actually still have to have, and which ones can we toss? And she said, that sounds great. Now, that sounds like a really quick and dirty kind of project. It actually took me 6 months.
Oh my gosh.
It took me 6 months, but at the end of 6 months, I was able to come up with one form, one from 4 to 1, that now they use to do the intake. And there's not a repetition of the same questions from form to form to form. And so now we've streamlined, we're taking less time.
Yes.
Right.
I love that. I love that on so many levels of just the ability for healthy conversation, right? She's clearly created a culture where you're able to go to this. And I love the emphasis on this, bring a solution, because that's a big conversation I have with a lot of my clients. It's like, okay, I understand that you don't like this one piece, but like, how do you envision it could be different?
Right.
And I think coming up with at least some semblance of a solution, because sometimes it can be really challenging when it's not clear cut or some of the things are outside of yourself, but it's like, there's got to be, even if the solution is we need to come together as a team and talk about this, right? To figure out what the solution could even be. And I think you said something so important that I feel like a lot of people, why people aren't willing to take that step, is you ask for a reduced caseload. It's like you are doing such a service to the hospital by doing that. I can't even imagine how much time and energy you taking that time has saved. Massive, like massive, I'm sure.
Yeah.
And it's like, so it's like you were asking to be able to have the time to do that and then presenting a solution. And I think that so often what happens is people are like, well, if I present this solution, it's gonna end up just being more work for me, and I'm already burned out, I'm already exhausted. So I just want to say that was like such a beautiful, like, encompassing of like healthy communication and how things can work.
And it ties back into that Surgeon General report when it talked about opportunity for growth and feeling like you matter at work.
Mm-hmm.
So personally, one of my strengths is organization. Right? And I can read through all of the dry governmental
Yeah, that
regulations
sounds
and all that kind of
terrible.
stuff and do all the tedious and stay very organized, which is a skill
That's
that a lot of clinicians don't really do
It's
well.
not my, I'm like, if anything is like government, like this, like any tax form, I'm like, oh my God, it's in another language. I can no longer know how to read. I'm like, what's my
Exactly.
name? I don't know.
Right.
Yes, I
And
love
so
that you
since
have
I
that
know that
skill.
that's a strength of mine, right?
Yeah.
Then that manager also knew that. And she
Mhm.
said, great, I have other strong clinicians. Not that I'm not a strong clinician,
Yeah.
but I have other strong clinicians that can pick up some of these other tasks while you do the thing that you do really well, right? And so that would be the other piece that I would talk to managers about when they are talking with staff. Ask them, what do you feel like is your biggest strength? What do you contribute to the team that you feel is over and above what somebody else may do? And what you might find is you might find that new team leader that you didn't even know was in the ranks,
Yeah.
right? And that team leader may be a 20-something-year-old, and it may not be the 45-year-old, right?
Yeah.
Because maybe the 45-year-old doesn't like being in charge,
Mm-hmm.
but you were promoting the 45-year-old to team lead because of their time,
Yeah.
because they're good at their job. Well, just because they're good at their job doesn't mean that they're going to make a great leader. But the 22-year-old may also be really good at the job, but may have great leadership skills and may feel really comfortable in that role. And so when managers come back and they say, hey, what do you contribute? What do you really enjoy about this position? Now, as an employee, I feel heard. I feel seen. And so what am I more likely to do? I'm going to stay working for that manager,
Yes.
right?
Yeah.
Because that manager sees me and they hear me and they want to help me to grow.
Mm-hmm. Yes, yes, I love that. At one of my jobs we all took Strengths Finder. The Strengths Finder is like quiz as part of the hiring process. And it was always something that was like brought into developing little teams and what we call them pods within that to make sure different people had different strengths. So I feel like that was something that was yeah, it really does make you feel valued. And when you are doing something you like, you're way more likely to do it and
You
work hard
are.
at it.
Yes, yes.
So I want to bring in, because you talked about it really beautiful for someone who's in the manager position. What about someone who's the employee who has a manager who they might not feel is receptive? And I think this is actually a really common thing is people get stuck in this cycle and this grind and they're like my manager would never listen to me. My boss doesn't listen. And obviously there are times where the boss doesn't listen.
Right, right.
But I will say the vast majority of the times that I have worked with a client to come up with how to approach their boss and have a conversation, and it's done from a way where they feel like empowered, they feel solid about it, and they're usually super nervous about it. It goes so much better than they expected, like 9 times out of 10. And so I'm curious if you see something similar. It's like, I don't know, I see, a small, very small subset of people. So it's like, I don't know what the percentage would be on a wider population, but I really feel like when you can come from a place of a win-win, you understand how it is a benefit for the business, and you speak from that angle. That's what I find to be super key. You're not speaking from the like, I'm so burned out and I'm exhausted, even if that's all true. Like, tell that to me, tell that to Sarah if she's your therapist, right? Like
Right.
but when you're having a conversation with your boss, it comes from like, here's how this is affecting the business. And here's what I think the solution could be. And it ends up being a win-win because you're benefiting from it and they're benefiting from it, as Sarah has spoken to, of all the like increased productivity you actually can see when you take care of your employees. I find people are receptive, and obviously there's exceptions and there's places where they try to be receptive and change doesn't happen. But I'm curious what you see or how you suggest approaching a conversation like that.
So I use the word "and" a lot, right?
Mhm.
So "and" meaning when you're talking with your manager, start with what is important to them.
Mhm.
People always want to be heard. So if we start with what's important to them, I've noticed that this is a really big project. I've noticed that the company is growing faster than we can really keep up. I've noticed that we have a lot of layoffs, or I've noticed that it's the summertime and a lot of people are calling out, whatever it is, right? So you want to talk to your manager about the things that are important to them
Mhm.
first. Make sure that they feel that you are aware, at least at some level, as to the challenges that they're facing. Once we have established that, then we go to our own personal experience. So let's use summer vacation. Summer vacations are coming up, right? So if I'm working in a place where a lot of people tend to call off for summer vacation and it's really stretching what the productivity, right? I might go to my manager and say, hey, I know that summer vacation times are coming up and that makes it really hard to schedule. And what ends up happening is that all of us start working overtime to cover up. And that's really costing you a lot because you have to pay me time and a half if I work overtime. For me, when I work overtime, I get really tired. I notice that my productivity slows down because I'm here longer and I have less time to take a break. And so I'm kind of sluggish when I come in. Or I've noticed that when I work those overtime hours that I'm more cranky and more irritable. And I don't want to live like that at home. And I don't really want to interact with my coworkers that way either. Could we now? So if you notice now, I've said this is what management is experiencing. This is how I'm experiencing it, right?
Mhm.
And now I'm going to present with a possible solution, right? Could we set up a rotation
Mm.
of how we get those times off? Or could we do more cross training so that when we take time off, we're not burnt out when we come back because our desk is piled up with things already that weren't done while we were gone, right? So
Mhm.
I'm going to offer what are the potential solutions. And then I'm going to say, where is my bottom line and where am I willing to adjust?
Mhm.
So my bottom line might be, I can tell you right now that a lot of us call out sick when we're not really sick because we're burned out over the summers because of the extra workload, right? So this is the potential consequence for you, right? Now I'm also going to let management know where am I willing to wiggle, okay? I think that a lot of us would be more willing to do 4 10s or 4 12s instead of 5 8s.
Mhm.
Or I think that some of us would be willing to come in earlier and some of us would be willing to work a little bit later if our schedules were adjusted over this time frame. What are some things that you think might work to solve the problem? Right?
Mhm.
So again, it's about the ands, and we've talked about that quite a bit today, really recognizing that we can't expect management to just fall at our feet and accommodate to everything that we are asking for. But the managers also can't expect that the employees are going to keep just pushing and pushing and pushing because they will burn out. They do get stressed, productivity levels decrease, absences increase because we know the mind-body connection. And I know that's a huge component of your podcast is that mind-body connection.
Mhm.
And when the mind is not being taken care of, the body shuts down.
Yes.
So we get the cold, we get the flu, we get the pneumonia, we get all of those illnesses, and then they can't come to work.
Yeah,
They just
exactly.
can't,
Yeah.
right? So now you have absences, you have increased healthcare costs, you have decrease in productivity, you have all these problems. So we really have to be willing to work on both sides.
Yes.
But those employees, if they approach management from that standpoint, and I will make one last point about that. I think that we also need to be aware of the significant culture change that has happened over the last 15 to 20 years. So I've got a little bit of age on me. And I remember beginning my work career and it being a culture where you were expected to turn off your personhood. Anything going on at home, anything going on with your kids, anything going on internally, turn that off, show up to work. And I often tell the story of I remember my very first retail job back when I was in high school. There was a sign above the time clock that said, leave it at the door. And it was very clearly stating, whatever is going on outside of these walls is not my problem. And so some managers that maybe are in the later parts of their career grew up in that mentality. And so there may be a little bit of pushback of not growing up in that culture. Now, my niece is 29, and she is coming up very much in this culture of wellness and of taking care of self. And, those folks that came through the pandemic and everybody went, yay, we get to work from home, right? Some of those younger managers, you may find a little bit less pushback. Those managers may go, oh yeah, I think that's great. Let's do the wellness thing. So I think that there is some validity there for your listeners that say, but my manager is never going to listen to that. I don't know that it's not that they're not going to listen, but you do have to understand, where are they coming from? What cultural background are they coming from in the corporate sector?
Yes.
Right.
I think this is so important, and it goes into one thing that I wanted to add on to what you said. It is one thing I find really helpful for my clients is to remember that their manager is a human.
Right.
And like you brought up like a merger, for instance, and it's like they're probably also experiencing immense amount of stress. You might not have any idea what they're going through at home. And I find this is really helpful for it's just like step into their shoes so you can speak to your first point of understand what they care about, or maybe even if you just take a moment to observe them of like, wow, they seem really stressed. Wow, they're all of a sudden you're seeing their snippiness, or maybe they are like really critical, is like, ooh, and it's not excusing it. It's just
Right.
it's
It's
just
understanding.
noticing it of like, wow, I can see where they're kind of this hair trigger. Like that means that they're super stressed. And so it's like when you can step into their humanity and understand what culture they grew up in, notice the language they use, then you can like choose which pieces to highlight the most. So like I had a boss where it was like the running thing of like, do not mention an emotion to her. Like, do not say any words that have an emotion. And so it took some finagling of like, okay, if I had an issue and was having a conversation like this, I had to like practice it in my head because I'm like a very emotional speaker of like, I'm feeling like, oh, that was a thing. You cannot say I feel. Do not start anything with I feel because you're done. Right. And so it took some, finagling of like how to present it so she cares about it. So she sees how it's affecting her business because that's what she cares about. And it didn't mean she didn't care about us. She actually did a lot. I think I saw that more in retrospect. I couldn't really see it in the moment, but it's just not how she communicated. It's not how she thought. It's not how she saw the world. And so when I could speak to her humanness from her viewpoint and what she cared about, I still got what I needed. Right. And she got what she needed. It's this win-win. And sometimes we have to be okay with just adjusting our language, just like we would for different friends that we have. We speak differently to our grandma than we do to our spouse. You know what I mean? It's like we do this every day. And so I think it is a willingness to adjust your language to your manager because it's a win-win. It's not like I've heard pushback on that of like, oh, well, then I'm shutting down myself. And it's like, no, you're not. You're
Yeah.
actually getting what you want out of it.
Right,
And it's a person that's sitting in front of you.
right, right. Yeah. And I think also, helping managers to recognize that in this discussion, we are not at all asking any of them to be licensed therapists. We're
Yeah.
not asking them to have therapy sessions with their employees.
Mhm.
We are simply saying that same thing. Both sides need to recognize that the other side is a human side,
Yes.
right? And that nobody's a robot, nobody's a number.
Mhm.
If we just start looking at each other a little bit more, just a little bit more as human, and how much further we can go with that, it would be really
Mm.
awesome.
Oh, that is such a beautiful sentiment. And I could keep asking you so many more questions, but we'll end on that because it is so, so beautifully said. Seeing everyone's humanity is just a wonderful way to make the world a better place.
Yeah, yeah,
Hopefully we can
we'll
all
keep
practice.
advocating for it.
Yes, I love that. Well, thank you so much, Sarah. I think this was really, really insightful conversation, and hopefully it's given people things very actionable that they can hopefully go do if they're struggling in the workplace. And if people want to learn more from you or talk to you more, where can they find you?
So my website is sarahharrisspeaks.com. And there's all kinds of great information there about the talks that I do and resources for how to access good communication skills.
Yes, and you can bring Sarah into your workplace or advocate that she gets
Mm,
brought in to talk to your
Right.
managers if that's something that you think could be helpful.
That would be great.
Yeah.
Be
All
happy
right.
to do it.
Yeah. Thank you, Sarah.
Thank you so much for your time. I appreciate it.